Morning, all of you. I am Mahendra Saini, Assistant Professor, Department of Pharmacy, Suresh Gyan Vihar University. Today, I will discuss about the topic is sexually transmitted disease like syphilis, gonorrhea. Next one. First of all, discuss about the learning objectives of this lecture. Based on the content in this chapter, the reader should be able to like introduction of syphilis and gonorrhea, epidemiology of syphilis and gonorrhea, and next one is pathogenesis of syphilis and gonorrhea, and next one diagnostic test of syphilis and gonorrhea, and last one learning objective is prevention of syphilis and gonorrhea. That are the learning objectives of this topic. Next one, learning outcomes of this topic. By the end of the lecture, the student should be able to understand. First of all, introduction of syphilis and gonorrhea. Next one, epidemiology of syphilis and gonorrhea, and pathogenesis of syphilis and gonorrhea. And next one, learning outcome is diagnostic test of syphilis and gonorrhea. And last one, learning outcome is prevention of syphilis and gonorrhea, means how to prevent syphilis and gonorrhea. Next one. First of all, discuss the what is STD. What is STD? What is sexually transmitted disease? What is sexually transmitted disease? Sexually transmitted disease is a group of communicable disease. STD is a group of communicable disease and transmitted by sexual contact. The communicable disease is transmitted by sexual contact. First of all, what is communicable disease? Communicable disease is capable of being transmitted from person to person, animal to animal, and animal to animal, and animal to human transmissible. It means communicable disease. And next one, caused by a wide range of bacterial, caused by a wide range of bacterial, viral, protozoal, and antifungal and ectoparasites, and wide range of bacteria cause sexually transmitted disease like viral, protozoal, and fungal agents and ectoparasites, and previously known as venereal disease. Ectoparasites. Ectoparasite, a parasite such as Phalia that lives on the outside of the host, and previously known as venereal disease. Previously sexually transmitted disease, also known as venereal disease, and sexually transmitted disease is also known, another name is venereal disease. Venereal disease also known as sexually transmitted disease. Next one. First of all, discuss the syphilis. What is syphilis? The causative organism of syphilis is caused by Spirochetes Tropinema pallidum. The causative agent of syphilis is Spirochetes of Tropinema pallidum, and caused by the syphilis is Tropinema pallidum. Spirochetes. What is spirochetes? Spirochetes are any group of spiral shaped bacteria, and some of which are serious pathogens for human causing disease such as syphilis and your lymph disease and elapsing fever. That means spirochetes. Next one, word derived from the name of the mythological mythological handsome boy Syphilis who was crushed by Greek god Apollo with the disease. Next one, Tropenum palladium, a coiled spiral fragments. Tropenum palladium, a coiled spiral fragments 10 micrometer long that moves actively in fresh preparations. The spiral fragments of Tropenum palladium is 10 micrometer long and that move actively in fresh preparations. And the organism is rapidly destroyed by heat, cold, and antiseptics. The Troponin palladium organism is destroyed by the heat, cold, and antiseptics. And next one, the organism can't be stand by the usual method and can be seen in the exudates and tissues by. Next one, dark ground illumination in fresh preparations. Dark ground illuminations in fresh preparations and fluorescent antibody technique. Fluorescent antibody technique. Exudates means is a fluid that leaks out of blood vessels into nearby tissues. That fluid and made of all cells, protein, and solid materials. And exudates may also from cuts or from areas of inflammation or infections. Dark ground illuminations. Dark ground illumination is described microscopy method. Dark ground illumination, dark field microscopy describe microscopy method in both light and electron microscopy, which exclude the unscattered beam from the image. As a result, the field around the specimen is generally dark. And fluorescent antibody technique. Fluorescent antibody technique. What is fluorescent antibody technique? The fluorescent antibody technique, the fluorescent antibody bind to the bacteria on a microscope slide and allowing ready detection of the bacteria using a fluorescence microscope. And last one, polymerase chain reaction. Polymerase chain reaction as a result method. Next one, epidemiology of syphilis. First of all, infected 12 million people in 1990, 90% of cases in developing world. The infected by syphilis 12 million people in 1990 and 90% of cases in the developing world of syphilis and affected 7 lakh to 1.6 million pregnancies a year and spontaneous abortions and stillbirth and congenital syphilis. Sponta- Spontaneous abortion. Spontaneous abortion, the spontaneous loss of a woman pregnancy before the third neck that can be both physically and emotionally painful. And what is stillbirth? What is stillbirth? Stillbirth is the death or loss of a baby before a during delivery, and both miscarriage and stillbirth describe pregnancy loss, but they differ according to when the loss occurs. And last one, what is congenital syphilis? What is congenital syphilis? Syphilis, congenital syphilis is a chronic infectious disease by a spirochetes tropinamate palladium and acquired by the fetus in the uterus before birth. And next one, Sub-Saharan Africa, Sub-Saharan Africa, 20% of prenatal death. Sub-Saharan Africa, 20% of sub-prenatal death. Prenatal death means is the period. Prenatal means prenatal is the period of time is the period of time when you become pregnant. Prenatal is the period of time when you become pregnant and up to a year after giving birth. And next, since 2000, rates of syphilis has been increasing in the US, United States, United Kingdom, Australia, and Europe, primarily among men who have sex with women. Next one, due to unsafe sexual practice, syphilis was due to unsafe sexual practice. And next one, syphilis increase the risk of HIV transmission and co-infection is common. And untreated is has a mortality of 8 to 58% with a greater death rate in males. The untreated syphilis has a mortality of 8 to 58% with greater death rate in males. And next one, 19th to and 20th century less severe symptoms, in which 19th and 20th century less severe symptoms due to widespread availability of effective treatment and decreasing virulence of the spiral jets. And next one, with early treatment, few few complications results during the syphilis. Next one, for pathogenesis of syphilis. Pathogenesis of syphilis. What is pathogenesis? Penetration. First of all, penetration of bacteria via the skin and mucous membrane through abrasion during sexual contact. Syphilis bacteria penetrate via the skin and mucous membrane that abrasion during sexual contact. Abrasion is a type of open wounds that caused by the skin rubbing agent against and rough surface. And also transplantly, the syphilis bacteria also penetration by the transplacently. Transplacently means passing through or occurring also the placenta across the placenta. And next one, dissemination. Dissemination means the spreadness of bacteria in body and by the lymphatic and hematologic. Lymphatic and hematologic means dissemination of syphilis bacteria by the lymphatic system, and hematological means circulatory system. Next one, diagnostic test of syphilis. Diagnostic test of syphilis. First of all, the pathogenesis of lesion appears to be due to host immune response. The pathogenesis of lesion appears to due to host immune response. And the two types of serological tests for syphilis. The two types of serological tests for the diagnosis of syphilis. First of all, terraponemal serologic test, and in which terraponemal serologic test measure antibodies to troponum palladium antigen and are as under first one fluorescent terraponemal antibody absorbed test FTAABS. FTAABS means fluorescent troponal fluorescent troponemal antibody absorbent test. And next one, agglutinin assay. Agglutinin assay. Fluorescent troponemal antibody is a diagnostic test for FDA ABS test is a diagnostic test for syphilis using antibody specific for the Troponema palladium species, and such test would be assumed to be more specific than. Next one, agglutinin assay. Example, microhematoagglutination assay for Troponum palladium. Troponum palladium and Serotp Troponum palladium, which is more sensitive. Next one, Troponum palladium passive heme agglutination test, TP, TPHA test, Troponum palladium passive heme agglutination test. Next one, the next one type of diagnostic test of syphilis is non-troponemal serological test. Non-troponemal serological test. These measure non-specific antibodies. These measure non-specific antibodies like IgM and IgG antibodies and immunoglobulins directly against cardiolipin lecithin cholesterol complex and are more commonly used. Next one. These are as number rather protein complex complement fixation. Rather protein compleximent fixation and test of choice for rapid diagnosis. The rapid diagnosis of syphilis by the rather protein complement fixation test. And second one is Vandral disease research laboratory, VDRL. VDRL means Vandral disease research laboratory test. And Wasserman described a complement fixing antibody against antigen of human syphilitic tissues, and this antigen is used in VDRL test. Next one, mode of transmission of syphilis. Mode of transmission of syphilis, first of all, sexual intercourse resulting in lesion, sexual intercourse resulting in lesion and glans penis, vulva and cervix. Next one, intimate person-to-person contact with lesion on lips, tongues, and fingers. And next one mode is transfusion of infected blood, and maternofetal transmission is congenital syphilis, mother is infected. Next one, stages of acquired syphilis. Stages of acquired syphilis, first three stages depending upon the period after which the lesion appears and the type of lesion. First of all, primary syphilis. First of all, primary syphilis, in which primary syphilis chances Cancers appear on genital or extragenital sites in 2 to 4 weeks after exposure to infections, in which primary syphilis infection cause 2 to 4 weeks after exposure to infection. And next one, initially the lesion is painless apples with ulcerates in the center so that the fully developed cancer is indurated. Next one, the cancer helps without scarring even in the absence of treatment. And next one, antibody tests are positive in 1 to 2 weeks after the appearance of cancer. Next one, secondary syphilis. Next one stage is secondary syphilis. Patient develop mucocutaneous lesions and painless lymphadenopathy in 2 to 3 months after exposure. Next one, antibody myeloid leukemia may be in the form of mucus patches on mouth, pharynx, and vagina. And next one, antibody tests are always positive at this stage, and it is a highly infective stage. The secondary syphilis stage is a highly infective stage, and spirochetes can be easily demonstrated in mucocutaneous lesions. Demonstrate means to show something clearly by giving proof. Next one, tertiary syphilis. Next one, tertiary syphilis, in which tertiary syphilis, after about 2 to 3 years following first exposure, tertiary lesions appear and much less effective than other two stages, and spirochetes can be demonstrated with great difficulty. And in which tertiary syphilis, the lesions are of two types. First one, syphilitic guma. Syphilitic guma. Syphilitic guma is a local inflammatory response. Syphilitic guma is a local inflammatory response of arteries or their surrounding tissues at the cerebral durameter or cerebral diameter, and caused by the invasion of Torpona pallidum into the central nervous system. And it is solitary localized rebrillation. Syphilitic gamma, it is a solitary localized rebrillations and central necrosis seen in organ like liver, testes, bones, and brain. Central necrosis is defined as a central or of low attenuation surrounded by an irregular rim of enhancing tissues. Next one, diffuse lesions of tertiary syphilis. Diffuse lesions of tertiary syphilis. The lesions appear followed widespread dissemination of spirochetes in the body, and these lesions are under widespread means found a happening over a large area, affecting a large number of people's dissemination. And cardiovascular syphilis. What is cardiovascular syphilis? The wall of aorta. The wall of aorta is weakened and dilated due to syphilitic aorta and result in aortic aneurysm and incompetence of aorta wall. And the aneurysm, a blogging and weakened area in an artery, and incompetence, the lack of the ability to do something well, the quality or state or not being consent. Next one, neurosyphilis. may manifest as. What is neurosyphilis? Neurosyphilis is a disease. Neurosyphilis is a disease of the covering of the brain itself or the spinal cord, and it occurs in people with syphilis, especially if they are left untreated. Next one, TAPS dorsalis. TAPS dorsalis affecting, in which neurosyphilis, meningovascular syphilis affecting chiefly the meninges. Meningovascular syphilis is a type of is affected the meninges. Meninges is a layer of brain and spinal that is protect the meninges and spinal cord, and TAPS dorsal affecting the spinal cords. TAPS dorsalis, TAPS dorsalis affecting the spinal cord. TAPS dorsalis is the slow degeneration of the nerve cells and nerve fibers that carry sensory information to the brain. Next one, journal paresis affecting the brain. Journal paresis affecting the brain. What is journal paresis? Journal paresis is one form of neurosyphilis, and it usually occurs in people who have had untreated syphilis for many years. Next one, congenital syphilis. Next one, congenital syphilis. Congenital syphilis is a chronic infectious disease. Congenital syphilis is a chronic infectious disease caused by a spirochetes troponum pallidum and acquired by the fetus in the uterus before birth, and may develop in fetus, or congenital syphilis may develop in fetus or more than 16 weeks who is exposed to the maternal blood, and a major cause of stillbirth. Congenital syphilis is a major cause of stillbirth. Stillbirth is the death or loss of baby before or during delivery, and both miscarriage and stillbirth describe pregnancy loss, but they differ according to when the loss occurs. And next one, pregnancies in women with primary and secondary syphilis. Pregnancies in women with primary and secondary syphilis and often end in spontaneous abortions, prenatal death, or a child with congenital syphilis. Spontaneous abortion. Spontaneous abortion, the loss of a woman pregnancy before the 20th week, that can be both physically and emotionally painful. And prenatal death. Prenatal death, prenatal mortality is defined as the number of fetal death 20 or 28 completed week of pregnancy equals the number of deaths among live-born children up to 7 complete days of life. And last one, antibiotics used to treat are penicillin, doxycycline, and erythromycin. That antibiotics are used for the treatment of congenital syphilis. Next one, measure neuro, measure morphological features of saddle saps, nose deformity due to distractions of bridge of nose, and the characteristics projections teeth, which are small widely spaced big saps fragment permanent teeth. Aquenous teeth is a sign of congenital syphilis, which occurs when a pregnant mother syphilis to her child in utero at birth. The condition is noticeable when a child premature teeth come. And peg, teeth. Back teeth are commonly abnormally shaped that normally affect the lateral ischias of a person. Sorry. Mucocutaneous lesions of acquired secondary syphilis. Mucocutaneous lesions of acquired syphilis. Mucocutaneous lesions includes chronic cankers or herpes, simplex virus, and number of conditions, candidias infections. Next one, bony lesions like epiphysis and periostosis. Epiphysis is also known as phthisis, is generalized bone disease of young growing horses, and that is characterized by enlargement of growth plates and long term such as tibia, long bones such as tibia, radius, and common bones. Next one, periostatis. Periostatis is condition that may runner are familiar with is caused by inflammation of periosteum. Periosteum, a layer of connective tissue to surround the bone that surrounds the bone. Next one, interstitial keratitis with corneal opacity. Interstitial keratitis is an inflammation of the tissue of the cornea. And next one, corneal opacity. Corneal opacity is a disorder of the cornea, and corneal opacity occurs when the cornea becomes scarred and this stops light from passing through the cornea to retina is that cause the cornea to appear and white or clouded over. And next one, diffuse fibrosis in liver and interstitial fibrosis of lungs. Interstitial fibrosis is a group of about 100 chronic lung disorders characterized by inflammation and scarring. And next one, diffuse, one of the most serious consequences of cognitive syphilis and neurological damage with mental retardation. Neurological damage is affect the brain as well as nerve fibers, nerves found throughout the human body and the spinal cord. Next one, treatment of syphilis. Early syphilis is treated by the benzathine means penicillin 2.4 megadose, and late syphilis is treated by 3 weeks IM injection of benzathine penicillin. Next one, prevention of syphilis. How to prevent syphilis? First of all, absences from intimate physical contact with an infected person is effective as the proper use of latex condoms. We prevent syphilis by the use of proper latex condoms, and congenital syphilis treated by screening mother during early pregnancy and treating those who are infected. Congenital syphilis is treated by screening mother during early pregnancy and treating those who are infected. Next one, the first choice treatment. The first choice treatment for uncomplicated syphilis is single dose of benzathine penicillin or a single dose of oral azithromycin. And next one, doxycycline and tetracycline are alternative choice but not recommended for pregnant women due to risk of birth defect. Risk of birth defect due to because doxycycline and tetracycline cause the ototoxicity. Next one topic is gonorrhea. Next one, sexually transmitted disease is gonorrhea. What is gonorrhea? What is gonorrhea? Gonorrhea, an acute infection, sexually transmitted disease of mucous membrane or the genitourinary tract, eyes, rectum, and throat. The gonorrhea is caused by the mucous membrane disease and caused by genitourinary tract, eyes, and rectum and throat. Genitourinary tract. What is genitourinary tract? Genitourinary tract system and urogenital system are the organ of reproductive system and the urinary system. Causative organism of gonorrhea. Causative organism of gonorrhea caused by gram-negative oxidase positive Diplococcus and Neisseria gonorrhea bacteria. Diplococcus, a bacterium that occur a pair of cocci, example Pneumococcus. Next one, pathogenesis of gonorrhea. Pathogenesis of gonorrhea, a venereal disease name employed by Galen. Venereal disease and name employed by Galen. The gonorrhea name is discovered by the Galen. Galen is a scientist. Venereal disease and infection transmitted through sexual contact and caused by bacteria, virus, and parasites. First step in infection is adhesion of gonococci to urethra and other mucosal surfaces. First of all, the infection is adhesion of the gonococci to urethra and mucosal surface, and the incubation period of gonorrhea is 2 to 8 days. And in men, the disease start as an acute urethritis with a discharge containing gonococci in large numbers, and infection extend along the urethra to parasites. Parasites and seminal vesicles and epidemesis. Gonococci is Neisseria gonorrhea, also known as gonococci singular or gonococci plural, is a species, a gram-negative Staphylococcus bacteria isolated by Albert Elzades in 1870. And incubation periods mean incubation period is the number of days between when you are infected with something and when you might see symptoms. And seminal vesicles, also known as the vascular or seminal glands, and are a pair of glands found in the male pelvis. And epididymis is highly convoluted duct, and we have that testis along which sperm passes to the defense. Next one, in women the initial infection. In women the initial infection involve urethra and cervix uteri. It may extend the Bartholin glands and endometrium and fallopian tubes and pelvic inflammatory disease and splenitis may leads to sterility. Bartholin glands are located on each side of the vaginal opening and they secrete fluids that help lubricate the vagina. Endometrium. What is endometrium? Endometrium is the lining of the uterus and fallopian tubes of one or two long cylindrical tubes that connects the ovary to the uterus, and eggs pass from the ovary through the fallopian tubes that the uterus. And splenitis is an inflammation of the fallopian tubes and caused by bacterial infection. Next one, Conjunctivitis may occur usually due to auto-inoculation by patient fingers. Sterility means the quality or condition of being sterile. And conjunctivitis is an inflammation or infection of outer membrane of eyeball and inner eyelid. Conjunctivitis is a pink eye disease and caused by allergies, viral and bacterial infections. And auto-inoculations means is a procedure in which cells are removed from the body and treated or medically changed in the flesh bag or to the body. Next one, blood invasion may occur from the primary site of infection and may lead to mesenteric metastatic lesions such as arthritis, ulcerative endocarditis, ulcerative metastasis lesion. Metastasis lesions, they first form primary cancer and travel through the blood or lymph system and from new tumor means metastatic tumor in outer part of body. The metastatic tumor is the some type of cancer as the primary tumor and controlled by arthritis. Arthritis is an inflammation of one or more joints and causing pain and stiffness that can remains with as. And ulcerative endocarditis is a rare and potentially fatal infection of the liner lining of heart, the endocardium, and it is most commonly caused by bacteria entering the blood and travel to the heart. And a non-viral infection is gonococcal ophthalmia. Newborn direct infections during passes through birth canal. Gonococcal ophthalmia, it occurs in neonates, is an infection that is transmitted by contact of eyes with infected genital secretions from person with genital gonorrhea infections and controlled by installing 1% silver nitrate solution into the eye of newborn. Next one, epidemiology of gonorrhea. According to World Health Organization, 88 million cases of gonorrhea occurs in year and 2010 to in which 2010 900 went down from 1100 in 1990 and in UK 196 per 1 lakh males and 20 to 24-year-olds and 133 per 1 lakh females in 16 to 19 years old were diagnosed in 2005 and, and in 2004 the rate of reported gonorrheal infections was 113.5 per 1 lakh persons and according to the CDC, overall African American are most affected by gonorrhea and black accounted for 69% of all gonorrhea cases in 2010. CDS means Centers for Disease Control and Prevention. Next one, diagnosis of diagnosis of gonorrhea. Traditionally, gonorrhea was diagnosed with gram spans and culture and polymerase chain reactions. Batch testing methods are becoming common and all people testing positive for gonorrhea should be tested for other sexually transmitted disease such as chlamydia, syphilis, and human immunodeficiency virus. Next one, treatment of gonorrhea. Antibiotic resistance has developed to a number of agents, including macrolide antibiotics, clindamycin, and rifampicin. And next one, ceftriaxone as third generation cephalosporin antibiotics may be as effective as penicillin-based treatment. Next one, CDC recommendation for uncomplicated gonorrhea. is ceftriaxone 125 mg single intramuscular dose or ciprofloxacin 500 mg single dose oral dose pulse and doxycycline 100 mg twice daily for 7 dose and erythromycin 1 gram single oral dose given in the treatment of gonorrhea. That are the references for the gonorrhea and syphilis sexually transmitted disease. Next one, multiple choice questions. First of all, this was syphilis. Option A, Entamoeba stolica. Option B, Neisseria gonorrhea. Option C, Plasmodium. Option D, Troponum pallidum. The right answer is D. Syphilis is caused by Troponum pallidum. Next one question. Syphilis is often called option A, the invisible detector, option B, the terrorizing intruder, option C, the greater impact imitator, option D, the greater terminator. The right answer is syphilis is the great imitator. Next one. In this stage of the antibody test it is found to be positive in 1 to 10 weeks post the appearance of the chancre. Option A, tertiary syphilis stage. Option B, secondary syphilis stage. Option C, primary syphilis stage. Option D, all of the above. The right answer is primary syphilis stage. Next one question. All of these are a differential diagnosis of the primary genital lesions for syphilis except for option A, donovanosis, option B, traumatic injuries, option C, cancroid, option D, Herpes-zoster infection. The right answer is B, Herpes-zoster infections. The right answer. Next one question. Experimental entities that are utilized for the study of syphilis are option A, chimpanzees, option B, rabbits, option C, both A and B, option D, none of these. The right answer is C, both A and B, chimpanzees and rabbits are used in the syphilis experimental entities. Next one question. Today's the main test that is used to diagnose syphilis. Option A, washup. Option B, water body. Option C, waterman. Option D, washerman. The right answer is D. Washerman test is used for the diagnosis of syphilis. Next one question. This stage is found to be the most effective stage of all. Option A, secondary syphilis stage. Option B, tertiary syphilis stage. Option C, primary syphilis stage. Option D, all of the above. The right answer is secondary syphilis stage is most effective stage. Next one question. Syphilis is a complicated and organized sexually transmitted disease where the causative agent. Option A, fungus. Option B, a virus. Option C, a bacteria. Option D, a spirochete. The right answer is C and D, bacteria and spirochetes. Next one, neurosyphilis is a option A, an infection of liver due to syphilis. Option A, major illness of the eye and babies due to syphilis. An infection of the kidney due to syphilis. A major illness in nervous system due to syphilis. The right answer is D, a major illness of the nerve system due to syphilis, also known as neurosyphilis. Next one question. Cancre of syphilis is found in the option A, throat, chest area and vagina. And option B, genital only. Option C, buttocks, backs, arms and legs. Option D, genital, anus, rectum, vagina, lips and in the mouth. The right answer is D. D is the right answer. Next one question. People with gonorrhea usually also have this disease. Option A, swine flu. Option B, herpes. Option C, chlamydia. Option D, AIDS. The right answer is chlamydia. And next one question. Gonorrhea is caused by which microorganism? Option A, Neisseria gonorrhea. Option B, ventral pallidum. Option C, propenum pallidum. Option D, C. perferiens. The right answer is A. Neisseria gonorrhea was the gonorrhea. Next one question. Which of the following disease is sexually transmitted disease? Option A, gonorrhea. Option B, syphilis. Option C, leprosy. And option D, both A and B. The right answer is D, both A and B. Gonorrhea and syphilis is a sexually transmitted disease. Next one question. Gonorrhea causing bacteria in which type of bacteria? Option A, gram-positive bacteria. Option B, gram-negative bacteria. Option C, none of the above. And option D, it is not a bacteria. The right answer is B, gram-negative bacteria. Next one. Gonorrhea is treated with antibiotics with confirmed to occur in treatments. Option A, antibiotics has been short supply. Option B, the bacteria that cause gonorrhea have become resistant to certain antibiotics. Option C, people have developed an allergic reactions to an antibiotics. Option D, all of the above. The right answer is B. The bacteria that cause gonorrhea have become resistant to certain antibiotics. Next one question. How can gonorrhea is treated? Option A, with antibiotic. Option B, surgical removal. Option C, there is no cure. Option D, freezing or burning. The right answer is A. With antibiotic, gonorrhea can be treated. Thank you. Thank you all of you for a wonderful session.